reminder, the Mental Health Prize. The Mental Health Data Prize aims to develop or to generate data-related insights or solutions, digital solutions or data science-related solutions to address the issues, the problems or challenges around mental health, particularly looking at anxiety, depression, and psychosis as the leading causes on the African continent. And with respect to that, using existing data sets on the African continent led by African researchers, and also looking at multidisciplinary teams that embrace the values around transparency, collaboration, and inclusivity. So I'm really pleased to have the team here, the two panelists, and I'll give them a brief moment to introduce themselves, maybe over the next 5 minutes. So I would like to introduce Joy Muhia, who is a coordinator for Mental Health Innovation Network, and she will introduce herself and talk about the work that she does, and perhaps a little bit about the organization and the Mental Health Network. Then I'll also ask Margaret, the lived experience advisor and lived experience expert on this panel, and she'll also talk about the work. She'll talk about herself and the work that she does around her lived experience. So thank you so much. Pleased to meet you, Joy and Margaret. I'll ask Joy over the next 5 minutes to say something, to introduce yourself, and then tell us a little bit more about the Mental Health Innovation Network before we get a deep dive into the work. Thank you.
Thank you so much, Sylvia, for the introduction. So my name is Joy Muhia, and I coordinate the Mental Health Innovation Network. The Mental Health Innovation Network is a community of mental health stakeholders, which brings people together in order to bring across the mental health information that is being generated globally. So basically, we are like a hub of mental health resources and projects. What we do is we basically help to break down the mental health information that is, be it through knowledge translation and knowledge synthesis, and showcase the different what mental health projects are available. And so there's a lot of amazing work that happens in the communities and on the ground, but people are not able to know what is going on. So we are basically highlight all the different mental health projects that are on the ground in the different communities and spotlight them to the global community. And MHIN is co-owned by WHO, Department of Mental Health and Substances, and London School of Hygiene and Tropical Medicine. And our 3 aims is basically knowledge translation, helping innovators to be seen, and also decentralization. So we have 3 hubs at the moment. We have an Africa hub, a Latin America and Caribbean hub, and an Asia hub. And basically people are able to join as members and also create organization profiles to basically showcase what work you do around mental health, as well as showcase any innovations that you are working on. And for the innovation, it needs to show some sort of impact or evaluation that needs to be made, so that people can be able to learn from how you are implementing the project. And then we are able to communicate any mental health opportunities through our newsletter, as well as showcase what are the latest resources around mental health, what are the latest organizations that have registered. And basically, you're able to join a community of mental health stakeholders who are able to learn from one another. So thank you.
Yeah, thank you so much, Joy. I hope you can now turn on your video. So I hope the host
Yeah.
has Yeah.
Yes, I've just gotten the host. Yeah, thank you for, I was not able to do it before, but now I'm able, thanks.
Yeah, sure. Thank you so much. Thanks for that introduction. I'm really looking forward to the discussions around the opportunities, resources, and the kind of work you do and how that fits into evidence. So I'd like now to ask Margaret, our lived experience expert, to introduce herself. So Margaret, over to you.
Yeah, thank you so much, Lydia. My name is Margaret, Margaret Usolo. I am a lived experience expert for Wellcome Trust, based here in Nairobi, and I am part of a team of lived experience experts, a global team that are based in different parts of, so basically globally. So basically, this is an introduction of lived experience. So from the Wellcome perspective, we understand lived experience as having a unique form of knowledge, insights, and expertise that comes from having experience of challenges in mental health. And when you refer to people with lived experience or lived experience experts, you're actually referring to people who either had identify as having experienced anxiety, depression, or psychosis. So basically broadly defined, either in the past or currently, and we also understand the challenges that come with access to mental health care. So then we do not need to have, somebody does not need to have received a formal diagnosis to be termed as a person with lived experience. So that is the definition that we go by of lived experience from Wellcome perspective. And just a bit of breakdown, I think for us, understanding lived experience comes from a point of enriching research study processes and also just adding a bit of relevance and also the human-centered approach when it comes to research. So the main basis why we champion for lived experience is, other than relevance, there is also the bit of feasibility of the findings and also adoption of the study findings, and also in terms of also implementation and also sustainability of the whole study. So when it comes to lived experience engagement, so there are actually a couple of different roles, a couple of roles that lived experience experts can actually engage in. So they can, in the research study, they can take part in, they can be part of the staff as staff team members. They can come on board as expert advisors. They can also come on board as co-investigators. They can also support the study through an advisory group or also as collaborators, and they can be involved in a myriad of process aspects of the study. For example, in terms of the co-design, so from the first step of the study until the last one, they can co-design the hypothesis, the study itself, also in the bit of implementation of the research itself, also in terms of reviewing and monitoring of the study, and also in terms of also dissemination of the study itself. So, so that is basically what the basis of lived experience. And in terms of lived experience expertise, we usually advise for it to be actively developed as the process goes on. So in terms of just able to inform the multiple aspects and stages of the whole research project, from the design itself to the delivery of the project to the dissemination, and basically just the overall impact of the research study. And so for, depending on the target, so for example, if you're doing a feasibility study or an observational study, so then the team, the community that you intend to research or to do your research in, then you basically need to involve people who have lived experiences of that. So for example, if it's young people, or if it's adolescents, or if it's people with past episode psychosis, or if it's caregivers. So basically that is a nutshell of what lived experience expertise. So and I think also the last thing to actually also touch on is the challenges of participant recruitment and retention, specifically in mental health. and clinical trials for mental health. So having lived experience expertise can actually support in terms of increasing the recruitment and also the supporting in terms of the retention. So the bit of so when it comes to also issues of safeguarding of the experts involved or the community that you're actually doing the research with, and also just also to be able to, it can also be able to lead to also greater community engagement and also trust. So in terms of having lived experience can actually bring an explanation of potential challenges and also opportunities for integration in mental health. So basically just to be able to not only just enhance it's scientific rigorous, but also in terms of also ethical consideration and also the impactful nature of the study itself. So yeah, that is it. So as from a Wellcome perspective, so every study that every research that we actually find from Wellcome perspective, then usually advise for teams to include lived experience from the start of the study to the end of the study. And one thing we also recognize is in terms of different contexts, in terms of the geographical distribution, in terms of access to care, and also other social determinants. So then the research teams need to sit down and actually contextualize lived experience according to the communities that they're actually engaging. So thank you, and back to you, Cynthia.
Margaret, and it's really very good setting for us that you've explained. You've really brought out the experience or the understanding around lived experience, but also what lived experience means in terms of the research perspectives, in terms of the whole data value chain when we start with the design of the study, when we conceptualize the study in terms of generating hypothesis at that stage, who is involved, and then going through the whole process of collecting, processing, validating the findings, and then dissemination. So it's a really, really important or core aspect of the work that we do. So I like that you've highlighted the entire chain and what could be the benefits of working with lived experience, given that we are looking at collaboratively working with people with lived experience. And the expertise is really what we need to understand in order to provide some perspectives to the work that potential prize participants will address. So, and I would like to go back to Joy, what you mentioned in the first instance when you talked about the work you do within the Mental Health Innovation Network, the fact that you get mental health perspectives from grassroots and perhaps organizations, things out there that are not very familiar or common, but then you take all the knowledge from those initiatives that are going across Africa, given that there's a special focus on Africa in this in the network. There's Latin America, there's Asia, and perhaps the lessons or work that you do informs what potential prize participants might look out for and where they might look for different things, whether it's collaborators or stakeholders or opportunities. And in terms of your experience in the work, Joy, that you've done with the network, can you please speak to what the data gaps are, or what data gaps exist that you think exists in mental health research that you sort of would like to speak about and you think are very much needed at this point for us to be able to consider those perspectives in a prize that is looking at addressing challenges around mental health. Thank you. So back to you, Joy.
Thank you so much, Sylvia. And yes, so through the work of knowledge translation, whereby we synthesize and make good research evidence available and in understandable formats, and as well as building capacity of innovators to be able to develop and host resources that support our members. One of the key things that we really try and encourage is gathering of good data, because lack of data on mental health is definitely blocking investment in services. And without the data on, for example, the number of people in need and clearly showing the burden of mental illness, it's very hard to organize services, to allocate resources, and even design effective strategies. So when it comes to mental health, we definitely still lack the basic data because in many African countries, it was never collected in the first place. And you'll find that there is lack of a comprehensive feature of mental health in the various country demographic health surveys. And this leads to there being a gap because other conditions, for example, malaria and TB, they are comprehensively captured in the demographic health surveys of the different countries. And you see they're able to, when you report what is exactly on the ground, you're able to get better implementation of strategies, able to develop even guidelines that will be able to tailor to your population needs, to the community needs. However, when there is no data, you find that there is a lot of impact when it comes to implementation of the work. It limits the effectiveness and efficacy of any treatments or interventions that are offered, because you need to know what is your population, what are their needs, to be able to know how to best address them. And depending on the various contexts, of course, there's a different cultural aspects that affect, for example, how mental health is understood. And this also needs to be accounted for, because our culture plays a key role in our social understanding. And so when it comes to mental health data that only captures a very tiny portion and doesn't show how the different communities understand mental health to be able to address that, you see, we end up having a mismatch whereby there's increase of stigma and discrimination, because you can't just bring about a Western concept and you want it to be implemented as is without it being adapted to our context. And so that is why we are able, through the Mental Health Innovation Network, to really showcase, so when it comes to Africa, what are the different projects or research projects and programs that have been carried out, what is the data around it, so that, you know, people are able to find this information. Because additionally, there are very many research projects where great work will be done. However, when it comes to showcasing this information, it's never available online. So where are people supposed to find this data? Or it will only be available during the period of conducting the research. But once the funding for the research ends, all the websites that they had and all the data, we will no longer find it. And years down the line, we need to be able to build on this information. And so that's why we try and make the data available, whereby we follow up with each project and showcase. So this is what they're doing at the moment. This is the impact they've had so far. These are the publications they've had. These are the engagements they're having in the communities. This is the outputs and the impacts of the work and how to reach them. And even way past the end of the projects, you still find the information, because we had already cataloged it in the Mental Health Innovation Network, where we use our website to showcase this information. And when we showcase the information, we are not showcasing it as our work, we showcase it as the different people who are doing the different projects. So we also, through your member profiles, you're able to link the work to whoever it is that is carrying it. That way, we're able to, if someone wants to have maybe a question that they might have or want to collaborate with these people, it is clearly stated, you know, this project, it's so-and-so doing it, and this is how you can reach out to the project if you want to know more about the project. And so this definitely helps be able to break down this information, because based on the data that is showcased, we can be able to develop, be it policy briefs or infographics that break down the information into simplified manner, and as well as a manner that different stakeholders can understand. So we realize that there are very many, there are diverse stakeholders, and we have to tailor the information to what they're able to, for uptake. So for example, for a policymaker, you need to be able to you need to be able to present the facts and do it in a brief manner, because, you know, most of them really don't have the time to read through a whole research paper, but they need the data that is being collected to be able, data needs to inform policy. So from the data that is provided, we're able to break it down to what suits policymakers, because, you know, it shows this is the facts, this is what is needed, and what are the recommendations. So probably a simplified policy brief. When it comes to service users, how can you break it down so that the knowledge, the information that is captured in the research, published research, can be a bit too technical and term heavy? So how can we break down that information to any layman that they can be able to understand, and be able to keep up to date with what is happening in the research that is happening in mental health? So back to you, Sylvia.
Yeah. Thanks so much, Joy. I think it's really good that you just spoke about how you try to address the issues around the data gaps and what data gaps exist. Perhaps also speaking to the other question that I had, how does having those data gaps limit the provision of mental health care in general in Africa? So you spoke a little bit to that, but perhaps from your network and your experience, what you could perhaps speak to us about is a little bit more, maybe, is the fact that you know that the data gaps exist, and what you're doing within the Mental Health Innovation Network to make it, to publicize the fact that we need data, and data is missing, is one of the key issues that could improve mental health care. But then what are the drawbacks of not having that kind of data? So maybe highlighting a few issues on how this limits the provision of mental health care in general in Africa. Thank you.
So thank you so much, Sylvia. And to answer your question, so basically, when it comes to, for example, policymaking, there are various aspects that we focus on. So there's the aspect of leadership and governance, there's the aspect of service delivery, there's the aspect of financing, there's an aspect of the health workforce, there's the aspect of medical products and the health information systems. So I guess I'll speak linking to these different aspects that I've mentioned. So for example, when it comes to service delivery, so when there is a lack of data, you find that there is definitely, this impacts the availability of what is the mental health care that is given. So you find that there is low, or rather one of the main challenges in low and middle income countries is accessibility, acceptability, and affordability of quality mental health services. And so basically showcasing the different projects or data that is available, we're able to first and foremost map out, what are the services that are available in your specific setting. And once you highlight the different services, how can you be able to link the services from the community all the way to the public health facility, so that there is no disjointing. And so this data is definitely important because it helps us to be able to ensure that linkage and the referral pathways are incorporated. And this helps to be able to not just reach the people who are able to go to the facilities, but also identify the challenges within the communities. Because many a times you find with mental health, people, with all the stigma, people don't come out to, for example, accept or go to the healthcare facilities, but if they're able to, work even with the community health volunteers in the community to be able to identify those who have the different mental health challenges, or even, capacity build them on various coping mechanisms for mental health, you'll realize that you miss a critical population, and it definitely impacts, how many people get to be referred to the healthcare facilities for further assistance. When it comes to health system financing, you find that programs such as TB and malaria have there's a lot of financial resources that are targeted towards them. For example, I think with TB and malaria, they've grown from 5.6 billion to 21.8 billion between 1990 and 2007. However, when we look at the mental health aspect, we find that there's little progress that in terms of finances that are delivered, or rather finances that are directed to treating mental health. So you find that these funds that are directed towards the treatment and research will eventually result in increased capacity to be able to tackle these mental health conditions. And so these things definitely go hand in hand in the sense of it helps also, when you have the finances, you're able to tackle to incorporate treatment and research, which leads to the data, which leads to people having more information on, these mental health practices, and being able to in turn tackle the stigma reduction around these mental health conditions. And then when we come to the health workforce, there's definitely low healthcare providers in terms of, when you look at the from Mental Health Atlas, the number of psychiatrists, for example, to the population is really low. And, likewise for psychologists, for be it social workers, when it comes to mental health care workers, you find that there's definitely a huge gap. And for there to be effective treatment, or even the research that links to the healthcare facilities, you need these healthcare providers. And so there being low healthcare providers, it leads to poor referral systems that don't fully incorporate, the mental health services. And this is, with the inadequate human resources or the human workforce, we have developed innovative ways, and even like many of the research projects have come up with innovative ways of task shifting to be able to bring about this aspect. And we are finding there's more increased research in terms of the elements of how task shifting, or using the available resources, or the maybe short courses on mental health, and as well as maybe using community health volunteers and equipping them on mental health and how to identify, and how this is able to impact on the uptake and impact of mental health services. So basically, to be able to strengthen basically like policymaking or mental health systems, we need to be able to integrate the different aspects. And these are aspects that you find being researched, in the different mental health projects. So you'll find different projects tackling different aspects of this mental health, of this health system building blocks or health system factors. And this all, when they all come together, we're able to have a better comprehensive outlook and approach to how can we best incorporate mental health or what are these aspects that we need, or how can we argue that all these aspects will be able to improve mental health services in our various specific contexts. And this will definitely create a health system that provides an evidence-based care while ensuring that, for example, the health workers are secure in their profession, we have adequate financing. And you see, with the data, if you have data that is incorporated, comprehensive mental health data. So for example, with an example of the demographic health surveys, many of them just capture mental health as a whole without necessarily going into for example, how many people have schizophrenia or like PTSD, like going into the mental health conditions and be able to map them out comprehensively. And without this information, how are we able to then showcase the need for funds to be able to be directed towards mental health to address this gap? So everywhere we say that mental health is a critical aspect that needs to be addressed, but we need to understand that, especially in policymaking, you need to show the facts. And these facts, where do they come from? From the different research that is done. And so, and once this research is done, we're able to showcase that, okay, so for example, there's a case for investment that was done in Kenya that, it shows how much, like when you invest this amount, this is how much you save when it comes to mental health. So you're able to find that if you invest in mental health, it shows the economic impact or the economic growth that is related to investing in mental health. And when you clearly show the positive impact of addressing mental health, that you'll find that we don't necessarily have to, it's not a tug of war of need for finances. This is clearly evidenced by the data that shows that we need this mental health, access to mental health care and more finances, for example, into the mental health aspects. And so I think linking it back to MHIN, we are not limited to one specific project or one specific topic. We showcase mental health research and projects across. So not literally all mental health projects are welcome. So we're not necessarily focusing on just one condition, but all conditions, so that people are able to find this information or this data on relating to their specific countries in terms of, this project is implementing, for example, the data prize. Once the research starts, once the teams have come up and we're able to get the data, so it will showcase, so in this specific country, this is what they've worked on, this is the output that they've had. And so now how can we simplify this information and ensure that it goes back and is feedback into the policymakers for them to be able to see the need for this, as well as even the funders and different partners. And this will help be able to reach out to different partners, and even member states are able to ensure that there is funding that goes towards mental health. And this, eventually it's more like a system where if one aspect is broken, the whole chain is broken. But if you ensure that, you've catered to the healthcare workforce, you've ensured that the mental health is captured in the health information systems, there's good financial services, the service delivery, and of course the leadership and governance, you find that we end up having effective and quality and evidence-based mental health services. And so even linking to MHIN, we ensure that we are focused on quality and evidence-based research that is generated to be able to ensure this linkage to the various stakeholders. Back to you, Sylvia.
Yeah, thank you so much, Joy, for raising those very critical issues around health systems. And I just want to get back to the participants that we have a chance towards at the end of the webinar to open up the discussion to the participants to ask their questions. But yeah, take note of your questions in the chat and we'll pick them up from there, or you'll have the opportunity to raise your hand and ask the questions. So thank you. I'll go over to Margaret. So in terms of the aspects around the gaps that exist with data, especially on mental health in Africa, in your own perspective and lived experience, expertise, perhaps over the period of time, what do you think are the critical data gaps that a lived experience can help us understand? What are the gaps that exist that we need to think about? And what is the role of that, or how does that not knowing what lived experience contributes to in terms of the data gaps that exist for mental health care? How do those limit the provision of mental health care? So over to you, Margaret.
Yeah, thank you very much for the question. So in terms of data gaps in regards to actually lived experience perspectives, I think it's very crucial for us to actually create very comprehensive and effective mental health policies and also interventions. I think that is the key thing that lived experience actually comes to help solve that gap that exists. And in terms of the data gaps and lived experience perspectives, I think one, the issue of comprehensive data collection. So you find that most research that actually conducted across the continent and also globally that not factor in lived experience perspectives end up having either insufficient data collection, either tools or methodologies, or even limited scope. And in terms of lived experience data so there's a bit of underrepresentation, especially for marginalized communities or ethnic minorities and also rural populations, and specifically also for people who suffer very severe mental health conditions. So having not factored in lived experience in terms of defining the data collection tools, then we might end up having underrepresentation, and also in terms of also limited scope. So limited scope in terms of focus in the specific conditions that are actually there, or even the demographics that exist. So we end up missing out on the wealth of experience that actually exists in the different mental health issues and also in the diverse populations. The other issue is also about issues on stigma. So I think in terms of stigma, there are different different issues that also pertain to that. I think one is in terms of fear of repercussions. So you come and share, then what next? I think in terms of also confidentiality and the potential negative consequences that actually come from people who've suffered from lived experience actually participating in research. And also, I think also in terms of just reluctance to share, of one disclosing the personal experiences can actually also lead to incomplete or biased data that actually exist. And I think also the other thing that exists is also in terms of the methodologies that exist. So in terms of, I think in terms of specifically for qualitative and quantitative methodologies, so you find lived experience can actually contribute much more to qualitative methodologies other than quantitative. So going with quantitative and leaving qualitative behind, then there is the bit of one integrating lived experience to it. And so I think in terms of that, then there's need to have various analytical approaches that is able to close that gap. And also I think the other thing that also brings to it is in terms of tokenistic involvement of lived experience to actually just contribute to data. So then and so just basically just them contributing to data without any real influence over the research process and also the outcomes. The other thing is also in terms of the cultural sensitivity, the cultural and contextual sensitivity that exists. So in terms of so there's a bit of the cultural barriers, one in terms of the frameworks that exist or the research tools that are actually there. So some may not be culturally sensitive or even appropriate, and some may actually also fail to actually capture the full extent of lived experience in various diverse cultural contexts. And I think also the other thing is also in terms of the contextual differences that exist. So there's actually need to have context-specific data that actually considers the unique factors, be it socioeconomical or even political and cultural factors. So basically just to actually cover the whole factors that affect mental health in different regions. The other thing also is in terms of barriers, specific barriers, be it technological and also logistic barriers. So you find that there are different ways to actually collect data, or even, for example, you find some research study go with digital data collection methods. So then we end up excluding those without access to technology or even internet connectivity, and specifically in rural communities, and also just people with in low income areas. And I think also in terms of logistical challenges, in terms of the time constraints or even transportation issues. So I think those are quite a couple of issues that actually contribute to having insufficient data. But now having lived experience added to the research processes and the research study, then it's able to actually contribute to addressing some of these gaps. And I think the first one is just having an inclusive research study or an inclusive research design that involves lived experience experts from the outset of the research study, the outset of actually designing this research study, from the research questions to the methods to the tools. So actually to design them according to one, the relevance, two, also the sensitivity to the needs, the unique needs that are actually there. And I think also the second thing is I mentioned about actually stigma. So then there's need of actually having lived experience to actually counter and reduce the stigma that that is actually present, or that may actually also that can actually also be generated throughout the study. And also the other thing is also in terms of having lived experience in terms of one, standardization, and also in methodology, choosing the methodology. So just being able to factor in flexible methodologies to be able to collect and analyze lived experience, so that you're able to have consistency, and at the same time you're also able to accommodate the diverse experiences that are actually there. Then also the other thing that is very crucial is in terms of also capacity building. So there's need of actually also capacity building the lived experience experts that are actually present, so that you, in terms of the trainings, also in terms of resources for both the researchers and also the lived experience experts in those research teams. So then they're able to actually collaborate effectively and be able to do the research without issues on decision making, or even just issues on power in terms of in the research. And I think also the other thing is also in terms of being able to actually utilize a diverse set of methods, either, so you can actually also have both the digital data collection methodologies, but also being able to have the traditional methods, so that you're able to also complement each other, so that one, you're able to ensure that the study, the whole process is actually very inclusive, and two, it's also able to be able to actually also just reach the diverse populations that it's actually intended to actually reach. So so issues on the data is very key in terms of one, being able to have, I think it actually just boils down to one, participant recruitment, and also two, just being able to actually engage the participants that actually started with them from the start to the last, and also the bit of actually community engagement, and specifically also very trust, so that then the data that is actually collected from this process, one, reflects is able to reflect the needs that actually of the lived experience, then it actually just leads to an easier adoption and also just implementation of the data that is actually there. Yeah, back to you.
Thank you so much, Margaret. And that brings out really very great insights on the lived experience aspects that will really contribute to generating a more informative data-related insights or solutions. So I really like the fact that you touched on all the aspects, from the research itself, the design, the inclusivity, whether there are people who are marginalized because of the way we collect the data. So having maybe some quantitative component is really key. And also knowing that, yeah, it goes right to the dissemination of the findings, but also looking beyond how do we engage communities better to address the issues that exist, the technologies, the fact that technologies could actually be a source of discrimination, or because in our setting, particularly in our setting, there are many people who may not have access to the technology. How do we address those issues, and how do we ensure we're being as inclusive as possible? So, and my next question to you is, Margaret, is to what extent are policymakers making efforts to integrate lived experience, or to what extent do you think that should happen, or what is happening already in this space? So I'll call on you, Margaret, yeah, over.
Sorry, can you please repeat the question?
So to what extent are policymakers making efforts to integrate lived experience in policy making, let's say? Or what, if it's happening, or if it's not happening, what should be happening?
So in terms of policy making efforts, I think especially in the space of mental health, there's actually been an increased recognition of the importance of actually integrating insights from lived experience experts. But this extent of the integration is actually, it varies across different regions and also across different contexts. So you get to so from the perspective of also Wellcome and the funding, its work in funding a couple of other research in various countries. So you find that in high-income countries, there's actually been significant progress in integrating lived experience into policy making in mental health. And so you find there is actually established advisory roles, there is established roles for lived experience in policy development and also in service design. But when it comes to low and middle income countries, so the concept of lived experience is actually quite new, and countries actually just opening up to what lived experience actually means and what it entails. So in terms of integration of lived experience is actually quite less systematic, but it's actually increasing thanks to the efforts of, for example, the APHRC. So that is one thing I wanted to put it out there. So in terms of other than the existing trends that are actually there, so in terms of the policy development, so you find there's actually been a couple of consultative processes that the policy formulation and the frameworks actually undergo. And in this, in the developing of the mental health policies, so they actually undergo these consultative processes that actually include and integrate lived experience, input from lived experience. So you find that this consultative processes range from, for example, in the consultations to the advisory committees, to even having these stakeholder workshops where lived experience experts actually brought together alongside clinicians or research scientists. So also in the other thing as well is also about advisory and creation of awareness. So so the lived experience experts actually play a critical role in advocacy and also in creating of awareness, so public awareness. So the perspectives can actually be being able to dispel the issue of stigma, but at the same time to be able to promote understanding of mental health issues from the mainstream clinicians to the policy makers. So in terms of the policy advocacy, then lived experience groups and individuals, and especially in the context, actually being involved in increasingly active in being able to advocate for policy challenges. So there's actually quite a number of challenges and barriers that exist to be able to effectively integrate lived experience, and some of them being stigma, discrimination. The other thing is also lack of resources and infrastructure. So the infrastructure and also the limited resources also affect to some extent the ways of which lived experience experts are actually involved. And this is able to also actually just hinder the whole process of development and implementation of inclusive processes. The other thing is also in terms of tokenism. So where lived experience experts actually just involved in a very superficial way, though they do not have real influence over the policy making or development of the frameworks. So being able to just ensure meaningful participation basically just requires commitment to actually just valuing and also acting on the insights that are actually provided by the lived experience experts. Then the other challenge is also in terms of capacity building. So for both the policy makers and also for both the lived experience experts. So being able to just get the necessary training and the necessary support, so then they're able to actually just contribute effectively and ensure that also just ensure that the policy makers are also very equipped to actually also engage with lived experience experts very constructively. So I think those are some of the mentions around policy making and lived experience, more so in our context in Africa. But if you find and also just to mention, other than not having the actually best practices that are there for us specifically as a continent. So you find, for example, when you go to the in terms of when you go to South Africa, they have a very integrated approach and model for lived experience that actually also it's in terms of that actually also define the community-based mental health care, and that was primarily the efforts of both lived experience experts in collaboration with the policymakers and also with the research community as well. So they exist best practices that you can actually copy from, but in the meantime, again, it's also just a learning environment. So being able to also just pick various learnings and being able to adapt it to the various to our specific context, and so that we're able to move forward from it. So yeah, back to you, Sylvia.
Thank you, Margaret, for that very insightful perspective. The fact that there is work going on in the continent in terms of those consultative meetings, the engagement, but there's still a lot of room for improvement in those aspects to bring lived experience to the table. And also very familiar with us with perspectives that are new and going through the learning process. The same experience with the mental health disorders by themselves, the kind of investments that we talked about, the fact that other diseases receive greater recognition, but less for mental health, and perhaps the gaps around data contribute to those flowing through those different impacts that we see across the health system, across the impact that it has on different individuals. And here is where I come to Joy again to speak about how can stakeholder collaboration enhance mental health care in your own perspective, in the work that you do. And perhaps take it on maybe in 2 minutes and tell us, or 3 minutes.
Thank you so much, Sylvia. I think the best way to start is with the definition of the mental health well-being, where it's like a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well, work well, and contribute to the community. And so mental health is an integral component of health and well-being that underpins our individual and collective abilities to make decisions. And it's crucial to personal, community, and social economic development. The reason I say this is because it means that we cannot deal with mental health with just, for example, the Ministry of Health. We need to be able to have a cross-cutting collaboration with, for example, different stakeholders in different sectors. So definitely, if people don't have housing, it affects their mental health, and it leads to several impacts. Likewise with education, with different economic, even when it comes to, for example, the police sector, right? The security sector, whereby even how people are handled, or they need to be able to be trained on how to handle, different mental health cases that they come across. So basically, there's definitely a need for collaboration in terms of the various sectors that are there, be it education, be it housing, be it generally the different ministries. There needs to be an incorporation of mental health in each of them, and not just in the different sectors, but even when we come to the various health conditions. So even, for example, within the Ministry of Health itself, there needs to be an integration or collaboration with people working in different sectors, because, for example, we can use or link up with, right now, malaria, TB, HIV/AIDS is one of the most financed areas. But we should not forget that mental health definitely forms a critical aspect in this, right? Even getting that different diagnosis will definitely impact how someone understands it and how they take it in, and how, now adjusting to the new aspects that one needs to adjust to. And so one of the ways is for collaboration is, incorporating an aspect of mental health into each of these different programs. And that also helps us to tap into the resources, because, you're able to go into a well-resourced area and tap into that, there's need for incorporation of mental health in that area, and that will be able to capture mental health. I also, in terms of as different professional capacities. So, for example, with the way the data prize is working, you're able to bring together people with lived experience, you're able to bring together statisticians, epidemiologists, practitioners. That aspect of collaboration with different individuals who are working in different sectors helps to strengthen the research outputs that we'll be able to get, and thus be able to have quality data, because we can't work alone. And then it is very important that we don't work in silos, because working in silos leads to duplication of the work, and you'll be able to find that someone else is doing something similar to what you're intending to do. Why not just join forces and able to have a much bigger impact of that? So that is why even through MHN, we're able to showcase, so what are the different projects that are happening, what are the people working in it, and people are able to reach out and collaborate amongst one another, even within the mental health space, outside the mental health space, within different sectors, and that will be able to have effective impact, and we'll be able to bring change in terms of mental health. So back to you, Sylvia.
Yeah, thank you. Thank you so much for raising that interdisciplinary perspective, the fact that it's very key to address the issues around mental health, which also speak to so much to the prize itself, the mental health data prize, the fact that this requires us to take this interdisciplinary perspective into account to address all those issues. It's not a one-man show that we are just looking at researchers or data scientists. So it's interesting to have that perspective. So before I ask, maybe my next question refers to why is it important for policymakers in Africa, particularly from ministries of health, to get involved in the data prize? And perhaps before you speak to that, this is Joy, I'll take this out on you, Joy, again. Before you speak to that, you also give us all and your perspective around who are these policymakers. When we say policymakers, if you think about, when you do the work within the mental health innovation network, if you try to let us know who are these individuals and then speak to why it's important for those policymakers in Africa, particularly in the ministries of health, to get involved in the data prize. So back to you, Joy, maybe a few minutes.
Yeah, thank you so much, Sylvia. And so basically, so maybe to start broadly, let me try and get us to diverse stakeholders. And who are the stakeholders? You'll find researchers, practitioners, policymakers, service users, advocates, and donors from globally. And so when we come to the term as a policymaker is basically someone who is a broad term that refers to people responsible for, be it amending or formulating policies. And so this many a times will definitely link to governments, because within country settings, governments are the ones who are in charge of formulating. Government is a policy-making body or arm. And then when we come to, we'll be able broader outside countries, we find there are different organizations which are mostly linked with policymaking. So for example, in the health space, we have the World Health Organization that develops policies for different aspects. And that's why they also have like the corresponding health conditions or different health aspects that they capture. And so basically, it's a broad term for people who are responsible for formulating or amending policy. And so when it comes to why it is important for policymakers in Africa, specifically ministries of health, to be involved, I think it is important because the underlying perspective is that research is what informs policymakers. So for these policymakers to be able to make this guidelines, or to develop the guidelines, to develop the different strategies, to develop the different policies, to be able to, for example, if it's a mental health policy, mental health act, mental health strategies, and most of them are like maybe 5-year strategies. To be able to do that, you need the research, you need the data that tells you what is the status of mental health in the community. What are the socioeconomic factors? What are the behavioral factors? What are the different factors in the community? What do the people need? And then that way you're able to, once you understand what is the need in your community or in your country, you're able to formulate policies that address that particular need. And that's the only way we're able to make good impact. So many a times policies are done through estimation, and it's not necessarily the best way, because you'll miss out crucial aspects, right? You'll miss out, there's that person in the community, in the village, their perspective counts, right? It is every human being counts, right? Their perspectives, collectively is what is be able to based on different people's experiences, and be able to understand, okay, so what is their cultural context? What are the factors affecting them? And then this information that we're able to gather, it's definitely valuable to be able to not just formulate the policies, but also in addressing, it ensures that these policies are comprehensive and address the various aspects. We are able to have, effective healthcare information management system that captures anyone who goes into a health facility. The same way we're able to tell, for example, 100 people walked into a health facility, we should be able to tell how many people walked in or are referred to a mental health specialist, right? It ensures the healthcare workers are adequate, because you're able to plan for, okay, so so basically this research shows the gaps, and with the gaps, you're able to even ensure that the finances that are brought in will be diverted towards addressing these gaps, and that is be able to effectively manage. And so it definitely helps in the the recommendations that are given, and the decisions around mental health and health. So I think it's definitely important because you cannot have one without the other, right? It's even these different stakeholders, they do, you cannot have one and miss the others. Yes, the policymakers are the people that, people see, your politicians, or, they are the front facing, but behind that, there are those researchers who do all this amazing work. You cannot miss out the lived experts because, nothing about them without them. So you cannot be giving policies that, don't impact me. They need to be effective enough that even that person in the village gets to feel the impact of what is being done at the top level, right? So it needs working, them being able to work with the researchers, being able to have, from the data that is given, being able to work with the committee that has different representatives from the multi-stakeholder or multi-sector teams that are brought in. We're able to have a comprehensive approach to mental health, and this is the only way that will be able to effect impact. Thank you. Back to you.
Thanks, Joy, for those insights. I really like the point that you said. Yeah, policymakers actually need the information to inform the policies that they develop, they formulate, or they amend all the amendments, and then the kind of investment that goes in there. So this is work in progress. There's a lot of improvement from the issues you just highlighted, and for the next bit, perhaps I would like to ask Margaret to speak to the potential contribution of lived experience within the mental health data prize. I know a lot of what you said actually speaks to what we do, but perhaps if you wrap it up, maybe in 3 minutes, will be great to hear the potential contribution of lived experience expertise in the mental health data prize. So over to you, Margaret.
So involving lived experience experts in the data prize, to be specific, can actually contribute to one, enhancing the relevance, but also in terms of looking at the ethical integrity and also the impact of the solutions. So just to make sure that the research is actually grounded in real world experiences, I think that is not where where lived experience is actually very key. And I think the first thing is in terms of designing the research priorities and also the questions that the research questions for the teams who will be actually participating. So that is one process that they can be involved in. The second one is basically just being able to ensure that the research projects that are actually being done are relevant and also accurate in terms of the specific context that they intend to be involved in. So just being able to give a more nuanced understanding in terms of the health conditions that are actually there, but also just being able to ensure that the data that is collected and the analysis of that data is able to actually reflect the experiences and the needs of the target population. And the third thing is also in terms of the data collection. So they can actually also be involved in the data collection and also the data analysis. So being able to just give the practical information on one, designing and also information of the data collection methods. So they can actually they can give suggestions in terms of more acceptable and also more accurate methods for the participants. So these are mostly inform on the quality of that data and also the reliability. The other thing is also in terms of the existing ethical considerations. So from some of the very key considerations ranges from privacy to consent and potential implications of those research findings on the individuals and the communities. So just being able to ensure one, the data, the process, the research process is very respectful and not exploitive to individuals and also to the communities, but also just being able to protect the dignity and the rights of the participants. So being able to bring on board strategies so that privacy is actually considered, and also in terms of the consent, giving the necessary information so that the participants actually involved in that study are able to be have the information, and also being able to give a very informed consent. The other thing is also in terms of the interpretation of the findings. So being able to just give the interpretation of that data to be able to identify any patterns or any implications that may not be immediate, may not be very apparent to researchers without lived experience. So then they're able to have a very comprehensive understanding of the data that is collected and also the implications of it. The other one is also in terms of testing, the developing and also testing. So they can also form part of the service user. So in terms of one, the design, and also in terms of testing of the interventions that have been developed. So being able to just give feedback in terms of if the interventions are practical or acceptable or even just effective. So then in terms of, I think one, they can be involved from the co-design of the process, so the developing and also the testing of these solutions, so that one, it's very user-friendly, and also being able to, the intervention that has been developed can be adopted by the intended population, and also in terms of dissemination. So dissemination of the interventions or the research findings that are actually being that have come out of the research processes. And also, I think the last thing is in terms of monitoring and evaluation of the projects themselves. So they can be giving feedback on the projects. So so that the outcome the outcome actually reflects and aligns with the needs of the needs of the target population. So it's actually a whole continuum process. So being involved from the first to the last, and just being able to just being able to, it's a whole continuum process. So they're actually involved from the whole process to make sure that it's actually very meaningful, and the outcomes actually also reflect the insights that have been given by the lived experience experts. So yeah, thank you. Back to you, Sylvia.
Yeah, thank you so much, Margaret, for highlighting the potential contributions of lived experience. I think it's a really, really core aspect of involvement of people who have lived experience engaging with other interdisciplinary partners or team members to make sense or to validate those findings, to understand the challenges from a contextual perspective beyond just the dissemination, and not looking at just different phases of the project, but throughout the entire project process to policy formulation. I think those insights are really, really useful. And that also brings me to the fact that, yeah, we started off with the data gaps that exist, and the data gaps and what the data gaps mean in terms of the impact or the missed opportunities that we have in the provision of mental health care. We've talked about the aspects about collaboration and how that may enhances our understanding of how policies are formulated, but also the research that we do informs the policies themselves. So we engage with the policymakers to draw those insights into the development and formulation of those processes. or policies. And at this point, if you think about the processes that policies go through, we may not be thinking of making impacts in maybe our products or solutions within the price. May not be looking at policy changes, but policy may stimulate policies or influence policies at that time, or take advantage of the policy windows that exist within the countries to make an impact. Perhaps before I would like to ask one more questions to the panelists before we open up the discussion for the participants. So one more question to Joy and to Margaret. What is your vision for mental health research and policy making in Africa? Perhaps if you tell us in one or two statements or 1 or 2 minutes, what is your vision for mental health research and policy making in Africa? So please take it on, Joy, and then Margaret.
Thank you so much. I think I'd summarize it in terms of research-driven interventions, better data collection, mental health mentorship, to be able to bring up people within this space, updated mental health policies and acts which incorporate the human rights practices. For example, there's many countries within the African context whereby their mental health acts, for example, have very degrading terminology. I think there's one that is called a Lunacy Act. You know, such terminology, I don't think they should exist in today's day and age. And also, of course, mental health financing and mental health in the communities, you know, investing in high quality research will be able to ensure that we are able to also communicate what this research showcases, and be able to invest in activities that promote mental health awareness and capacity building, you know, for the various stakeholders. And even as there's this conduction of great research, we should also be able to communicate the outputs of the research, because it's only when we communicate is when we'll be able to reach to the various stakeholders. So we should be able to communicate amongst ourselves, you know, what is the output of the different research that we are carrying out. Thank you.
Okay, thank you. Thank you so much. And to Margaret. So I'll speak to... So Margaret, your vision for mental health research and policy making in Africa.
Yeah, I think my my vision is basically an inclusive and participatory research that one reflects on the needs and the perspectives of people whom it tends to reach out to. So one, just having a research that one has a translation potential, so not just having research that is being done, and once the findings have been done, then that is just it. So research that is able to be translated and implemented, research that basically just reflects the inputs, the needs, and the perspectives of people with lived experience. So that is my vision. Yeah.
Thank you so much, Margaret. And apologies for our French speakers. I just realized there's a comment there, but I'll ask the host to speak to that at one point. I think they should be. We apologize there, and we should be able to provide the translation for this. So I'll just take note of that. Joel and Diana on the call. So I would like to open the questions, open the floor for questions from participants. So please, if you have any questions, this is for Margaret and Joy. Please go ahead. So you can raise your hand or type your question in the chat. I think we have one question in the chat. So Joel, are there questions in the Q&A or in the chat that or please raise your hand and ask the question. So maybe I'll just speak to the first, there's the first question in the chat. So sorry, apologies for that noise, but why Africa is still poor is that a lot of youths are suffering in different mental health conditions. So we should collaborate to give an insight to the cause of poverty, war, famine that is due to mental health problems. Perhaps that's a comment, or perhaps the person who put this in a chat can open the microphone and then speak to this. Is it maybe a comment or? So this is.
Yes, you can. They can raise their hands and we can unmute them. Yes.
So that's a question from Chalecho, or comment from Chalecho. Perhaps if they want to verify their comment or clarify with the panelists, that's also an option.
Yeah, we have another question from Kelvin. That Joy suggests that mental health intervention and data collection can be handled at cross-cutting issues or using a multidisciplinary approach. The question, how can the weakness such as challenges of monitoring and evaluation difficulties, the complexity of coordination, and lack of clear mandate and ownership when implementing cross-cutting programs be addressed? Don't you think the ministries of health should read? So that is the question to Joy.
Joy, okay, okay, that's.
Yeah, happy to answer, Kevin. So yes, in terms of a collaborative approach, we need to be able to work with the different stakeholders. Now, yes, this does pose a challenge in many settings, but this is mostly because everyone wants to own a project, right? You want your name to go with the project. However, we need to accept that there's a role for the different stakeholders. We definitely need to work with the Ministry of Health because they're the ones who are in charge of the policy formulation in the specific country. So if you want, the impact to be translated, you definitely have to involve them. However, there's also the role of the civil society organizations in this whole, in terms of the advocating and, involving them in the process helps, there's an aspect where they're not, there's a step further and there's a role where they're able to reach to a different group. You cannot work without, the lived experience, experts, the different NGOs. So I think definitely everyone has a role to play. However, for the best or for effective implementation, you definitely need to involve the Ministry of Health because remember, they also, there's a mandate, they have the country mandate for progressing. And because it is a government office, they are always welcome, or they welcome collaborations with different people, even finding out the different projects that they are carrying out and, collaborating with them, supporting in terms of the implementation of the different projects that they already have. They definitely have mental health strategies, mental health policies that, they follow in terms of implementing. So even when you're writing your research, if you incorporate an aspect of what your country mental health policy states, you're definitely able to get the support. There are different ways we can leverage and work with the different stakeholders, and I think it's important for whenever you're working with the different stakeholders, we need to stop this, oh, it's my project, but it's our project. Remember, it's in the collaboration, we need to kind of, that the aim is for the better good of the people, not just for you. So if you're working towards the better good of the people, you'll be able to, accept all the role of the different stakeholders and work collaboratively. And this definitely, remember, the aim is at the end, the impact. We want to transform the mental health services or the mental health care in our respective African countries. And so collaboration is a key. And, working with understanding the role of each of the different stakeholders, the role of the Ministry of Health, because you cannot work without it, the role of the different CSOs, and how can we come together, the role of the research institutions, the role of the healthcare facilities, how can we bring them all on board and be able to effectively work together? Back to you.
Yeah, thanks, Joy. I think that's a really good thing. I see where, yeah, sometimes we think the Ministry of Health should lead. Perhaps the policies lie with the Ministry of Health and they play a very big role. But yes, it takes a multidisciplinary perspective in that. The next question is a very interesting talk. Can the panelists say something about mental health financing as far as research and services are concerned in Africa? So this is Vincent from Rwanda. So please take a minute to address that question.
I can start. When it comes to mental health financing, it has generally been low. Starting from within the countries, when we talk of the in terms of the health budget, what percentage is mental health? And many a times it's around 1% of 0.001%, which definitely, plays to the importance and the services that will be delivered. And so this, however, is changing, and that's why we need the data, because remember, the data shows the facts, and the facts lead to us planning effectively for, what are the type of the healthcare workers that are needed, the type of services, and to ensure all the different aspects are put in place, we do need that data. And so over time, once, for example, I know there are countries that have started having more, or at least incorporating mental health. There's an aspect of mental health in their demographic health surveys, and that is a big step. And this also definitely helps in terms of reaching out to different funders. So when it comes to reaching out to donors and funders, and even, member states reaching out to the different funders, this data does play a role. And over time, we're seeing that there's more mental health dedicated funds that are coming in. We are still a long way to go. But there's definitely progress, but I think there are different levels. So we need to start with, the mental health aspect of the health budget within the different countries. That needs to be, 0.1% really doesn't cater too much. When we come to the practical implementation, there's only so much, they can do. And also, there's now more, even like Wellcome Trust is funding mental health, as mental health is a big aspect, even with the data price. So there's definitely progress, but I believe more needs to be done. And even each country needs to be able to allocate the proper budget allocation for mental health within their health budgets.
Yeah, and perhaps thanks so much, Joy. I think even as we think about looking for financing from mental health, we really need to be very proactive with our governments, with our ministries, to make those kinds of investments in health. With Africa, most governments provide less than 1% to mental health care within the health system. So we hope that this, as Joy, you say, improves over time, or is already improving in some countries, so which is good. I think the next question is related, Joy, to the one we had. I think there's a question there from Alexandra. If there's any funding that can be allocated to research that the London School can give. At the moment, he's doing research that is being carried out, but their mental health needs that are enormous. I guess that's something that you can try to speak to. If there are donors or institutions that can support such activities, yeah. We know the Mental Health Prize is trying to address this as well, but there are so many out there who are providing this kind of support. So Joy, over to you again.
Thank you for that. I think to that, I'll say there's need to leverage existing resources and relationships in terms of and collaboration. So there are a number of grants, right? But many a times don't just expect it to just be mental health, right? You need to, it can be a broad aspect that you can incorporate a mental health aspect into it. And also, you know, linking up with different researchers or different people who are working in different aspects that, you know, you'd like to go into, reach out to them, and you never know, you might just end up writing a grant together. I think also how to write grants and all that is also normally a challenge for us. So that's where, you know, this data prize has been able to give us the skills on how to do that. But I would say that when we're looking for these grants, let's not just look that unless it says the word mental health. That's the only way, you know, it will be covered. There are different ways, you know, there's a socioeconomic status. You can incorporate mental health in different ways, and this can be able to cater to the different aspects within, you know, tailor it, how you address the question, you know, tailor it to your situation, and then incorporate the aspect of mental health. And then there are definitely many grants in terms of the NIHR, the Wellcome Trust, but it's how do you tailor it? How do you work around the wording of it? And also reach out to people, you know, there's a researcher you found who's working in a specific place, reach out to them. You might end up, you know, working on a project together. Even through the Mental Health Innovation Network, you have very many people working on very many projects that you can link up with and be able to collaborate. So I think at the end of the day, it's all about a collaboration, you know, forming these relationships with people, even people outside the mental health space who, you know, you have colleagues who are in the health sector, and for example, they're writing for TB or HIV/AIDS, you can come in and be like, but there's an aspect of mental health that you need to include, and I can contribute in this and this way. And that way you've incorporated mental health into the various health, other health conditions. And so let's be proactive, as Sylvia has said, and let's look beyond the box.
Yeah, thank you so much, Joy. And really good to hear those perspectives. The next question to Margaret. Thank you for the brilliant. The next question is about, presentation. So this person is asking, in our context, especially the role they need to understand better the role of individuals with lived experience. So lived experience experts in research and policy. So in our context, with the resultant stigma, it's difficult to fully engage. I think you mean people with lived experience. How feasible is this in the context of the research that is culturally sensitive? So back to you, Joy. I think this is really speaking to the work that you do.
I think Margaret also wanted to say something. I can let her go first.
Sorry, Joy. That's Joy. Sorry. That's Joy for lived experience.
And I think Margaret.
It's Margaret. Yeah, sorry. So Margaret, if you let us know, maybe speak to the context with stigma, its difficulty in fully engaging people with lived experience. How feasible is it in our context of research that is culturally sensitive? So Margaret, over to you.
I think before I jump into this one, I just had some thoughts just to add on the previous two questions.
Yeah,
One,
sure.
I think in the question why mental health research in Africa does not attract sponsorships. And I think three things come to mind. I think one, in terms of availability of pilot data or any existing data. Two, in terms of the research infrastructure that is currently present. And three, also in terms of availability, or I can put in terms of multidisciplinary expertise that is needed for most of this research. So one, we started by highlighting the access to limited data, and I think that is one thing that really contributes to not a lot of funding coming in. And I think also too, in terms of there is not much investments that come in for development of infrastructure for research. And that is one thing that also contributes to now not having this research, then we are a bit disadvantaged in terms of the research that can actually be undertaken in the continent. And I think also that the last one is the multidisciplinary collaboration. So we get to have teams actually working in silos. So you get to have clinicians doing their own research, research scientists doing their own. We do not get to incorporate as many disciplinaries as possible. So those are the three issues. And I think at the moment, so for example, for Wellcome, there is a lot of funding coming in. There's a lot of funding that is actually coming in, and that is specifically for low and middle income countries. There's also Wellcome also, as much as possible, tries to encourage high income and low income collaboration for research. So you get to have a research team maybe based in Canada collaborating with a research team based in Nigeria or Ghana or Kenya or South Africa. So that is also one thing, just to be able to boost the research scientists in different demographics. And I think also the other one is also in terms of quality of applications that also come in to most of these big funders. So that is also one thing to actually look into it. So now coming back to the issue of stigma, and lived experience. So lived experience is it's quite unique. You cannot quantify lived experience. You cannot say I've had challenges with mental health for the past 10 years, and I've had mental health challenges for the past maybe 1 year. So the expertise is very unique to different people. And in terms of integration of lived experience in the specific research teams, then there's also the bit of having safeguarding mechanisms. So that you're able to also look into the other specific ethical considerations for involving lived experience experts in the research teams. So starting from the consent to confidentiality to privacy, and also in terms of also safeguarding mechanisms, just in case, so that safeguarding mechanisms to protect the individual, and at the same time to have referral mechanisms that are actually needed. So that is one thing to actually really bring forward when actually engaging with lived experience experts. And I think the other one is also in terms of power dynamics between lived experience experts and also researchers. So because these are basically just insights that are actually just personal insights, and yet other researchers come with experience of educational backgrounds and also professional experiences. So us having to actually just take both experiences and regard them with the same level of basically just regard them equally will actually just be able to actually just also ease the whole process. And so there's also the need of actually just capacity building, also the lived experience experts that actually brought on board. So in terms of the resources and also in terms of in terms of the trainings that are actually needed for the research. So yes, back to you, Joy. Sylvia, sorry.
Yeah, thank you very much, Margaret. I think it's very good points you raise. The issue around the stigma that results from somebody saying, especially and this happens everywhere, in the workplace, in different settings, maybe in the home, in the environments, in the societies, in the communities that we belong to. So it happens all the time. And one of the things that the data prize will hopefully contribute to, or will contribute to in a big way, is the fact that we will embrace the lived experience integration in the research that we do. And the way to do it is to ensure, one of the ways that Margaret said, ensure that we have safeguarding principles in place. And that's something, not because we should do, if you think about it, we should be doing, even in the normal circumstances, given the global burden of mental health disorders, and many of them undiagnosed. So if we think about globally, 1 in 8 people experience a mental health disorder. What does that mean? So 1 in every 8 people, whether it's in your home, at your workplace. So the burden is huge, and most of it is undiagnosed, or almost 70% undiagnosed in the African setting. So how do we ensure that we bring as many people on board, and they can feel safe, not stigmatized in that sense? So this is the lessons and learnings that we should take from the prize, and through the implementation, the capacity building to support that. Yeah, thank you so much, Margaret. Maybe the next question. Maybe you have addressed, I don't know, Joy, if you have any additions. Yeah, really good to hear. So that was points well taken. Yeah, I think this is the one person asking whether we could do continent-wide projects. I hope, Chaleshwa, that means, could you do multi-country projects? Yes. So there's no restriction on that. So, okay, maybe Joel or Diana, the participants don't have access to the speaker. So maybe if you raise your hand, or if you would like to speak, then...
Yeah, okay, Priska, go ahead. I've allowed you to
We'll
speak.
take the questions now from the audience. Thanks.
Hello. Hello, thank you for giving me this opportunity. I have 2 questions that I would like to ask Joy. So the first one is that when it comes to making policies, one has to go through a lot of research, that is through situational analysis and evidence-based analysis using data and the various research strategies to prove to the government that they can take up a policy and implement it. So, in your experience, can you say that there are researchers who actually go to these lengths to prove that a certain policy is important, that it should be taken up by the government? Because most of the time, there are very good policies, but there is not enough proof that they are actually needed by the general public. The second question is that I looked into the Kenya National Health Policy that is geared towards Vision 2030 and the SDGs, and most of the gaps there are inequalities and also insufficient collaborations. So, can you say that it is usually easy for the government to accept non-state actors who are the collaborators to partner with them and come up with these policies? or is it something that is very challenging? Those are my questions. Thank you.
Thank you so much, Priska, for your questions. The first question is if researchers are able to go to the great lengths to prove the evidence for the different policies. I say yes. I say that the way even the stakeholders that work, even like the Ministry of Health, the officers within the mental health departments, they are definitely qualified physicians or qualified researchers, and they're also carrying out work outside this. And so that's how we need that collaboration with different people. And these policies are not made in a silo. They normally invite different stakeholders, they sit together, and they're able to, review these documents. There's normally like public participation and all those aspects. So these policies are not just done somewhere in a closed setup or like someone makes all the decisions. No, they're normally definitely evidence-based. And in terms of does government accept the collaboration with other stakeholders, if I'm rephrasing your question correctly, I say yes. I do believe that ministries of health and they do acknowledge the role of the different actors. There's definitely the element of, so for example, the Ministry of Health will make the policies, but they cannot work without the different NGOs and the different health facilities and the different research institutions, in terms when it comes to implementation. When it comes to implementation, you definitely need the different, for example, NGOs or CSOs to be able to even incorporate an aspect of some of these guidelines or projects in their projects when they're writing proposals for implementation, to get donors. If you incorporate an aspect of what, the government is working towards, there'll definitely be support. And that also definitely feeds back. Also, going to the Ministry of Health with the outputs that you have of your research, at times they may not be aware you're doing it because maybe you may not have involved them from the word go, but it's government office. So it doesn't hurt to let them know that, oh, I've been working on this is the output. It really doesn't hurt, to be honest. But yes, there's definitely a lot of, before any policy is made, there's definitely a lot of collaboration, not just with the policymakers, but it is multi-stakeholder, multi-sectoral approaches. And glad to say that, for example, in Kenya, they do nowadays ensure that there's a lead expert in every committee or board that is pertaining to mental health that I know has been incorporated in Kenya. I'm not sure about other countries, but there's definitely a lot of progress. And different countries have different mental health specific policies at the same time. So like in Kenya, I know you're talking about the Kenya National Health Policy, but there's definitely very many, like there's a Kenya Mental Health Policy 2015 to 2030, like there's mental health related or mental health specific policies. There's a Kenya Mental Health Action Plan. So there's definitely a lot when it comes to mental health. And I think those are very comprehensive and they are very data driven. Thank you.
Yeah, thanks. Thanks so much, Joy, for that. I don't know, Margaret, do you want to add something, or are there any more questions maybe one question from the chat? Why is it that mental health research in Africa does not attract sponsorships from donors? I'm not sure in other regions of Africa, but yeah, perhaps. Yeah, that's from Timothy. Let's not wait for specific mental health funding, but packaging our ideas in already existing projects. So that works. I think there was a reference to this. So perhaps unless you have something else to add on. Any more questions from the floor?
We do not have any other raised hands.
So, yeah, so I think the reference for that comment was there are opportunities to lobby for the inclusion of mental health in the annual budgetary allocations to Ministry of Health to be funded by the Treasury. That's also a good comment. So maybe back to our panelists who have been very provided very comprehensive understanding on the policy making in the African continent through the Mental Health Innovation Network, and then our understanding of lived experience, expertise, and how those two aspects are actually embedded within